Tonight, the tragedy that has impacted hundreds of people, and yet no one is talking about it. Yesterday in Markham at IBM headquarters, a man jumped to his death. These are just some of the emails and texts we received from people impacted by the tragedy. They wanted us to talk about it, so tonight we are tackling this very difficult subject. Throughout this story, there will be a number on your screen for a crisis hotline. It happened inside this IBM building on Steeles near Victoria Park. A male employee jumped from the 7th floor down to the atrium below. In this photo, police are on scene, and steps away there is a poster encouraging people to talk about cancer. Suicide, though, has long been a taboo subject. According to this mental health advocate, it's time to change that.
We absolutely need to talk about suicide. There's a misconception that when you talk about suicide, it gives people the idea to go out and do it, as though they had never thought of it before.
Mark Hennick knows what it is like to contemplate suicide. He came very close to taking his own life when he was a teenager.
Not talking about it at all doesn't mean it didn't happen. There's still dozens, hundreds even, of people who are impacted by this individual suicide, either as a witness or a friend or family member, and that needs to be talked about. Those people need to be helped.
In an email to CityNews, an IBM spokesperson said counselors have been on site since yesterday. Employee assistance plans have been reinforced and flexible work options provided. Suicide takes roughly 4,000 Canadian lives a year. A study in the American Journal of Preventative Medicine concludes death by suicide in the workplace is on the rise, and managers need to be better trained to detect it. However, Marianne Bainton from Workplace Strategies for Mental Health believes teaching employees resilience through team building is far more effective.
It's not fair to ask managers or employers to become mental health experts. But there are ways to build the resilience of employees, and this resilience helps them in their personal life, helps them with their mental health, helps them with their work as well.
Now, these emails that we received hinted as layoffs as a possible cause. IBM, though, says there are absolutely no truth, and those are just rumors. If you are in distress, again, the number on your screen is a hotline number that you can call. How can somebody help them?
Don't be afraid to ask. And if you're afraid that suicide is a possibility, even if it's just a bad feeling, a gut feeling, ask the person. Ask the person if they're thinking about killing themselves. Most people don't want to do that. They get really uncomfortable about asking that question because they fear, if I ask them if they're thinking about suicide, what if they say yes? Then what do? I don't know what to do. You know, if that's the case, and if you don't know what to do, then call 911. You wouldn't pass by somebody having a heart attack in the street, so you shouldn't pass by somebody who's in psychological crisis either.
If your colleague acknowledges, yes, they are struggling, what do you do then?
Most people switch into what I call fixer fixation. They want to try to fix all the problems. They want to give them all the solutions and all the tools. And that can be very helpful if that's what the person wants. Usually, though, what the person wants is just somebody to listen. They want somebody that they can vent to, that they can talk about their problems with, and who's going to listen to them non-judgmentally.
Is there a responsibility to alert somebody in the workforce if a colleague comes to you?
There absolutely can be. And if you're really afraid that this person is at risk of dying by suicide, and even if they tell you not to tell anybody, that's not something that I'd be comfortable keeping a secret.
If you or someone you know is in distress, our website citynews.ca has a list of resources for help.